We've been told by the health authorities a certain percentage of our population is asymptomatic to the coronavirus. These people may be walking around in our society without symptoms and may be contagious to others. How do we know this is true? Is it fact or is it a myth? Based on our previous experience with the common cold, it seems to be a reasonable assumption. However, how do you detect something that you cannot see? This is not always easy. One way is to see the effect that something may have on the environment to show that it exists. For example, looking out your window to see if it is windy. If you see leaves flying around, you can safely assume that there is a breeze. Though you can't see the breeze, you can see the effect of the breeze. There are two questions before us. Does the asymptomatic population exist? And if so, how big is it? Before attempting to answer these two questions, let's take a look at the different possibilities of contracting the virus. There are really only three sources of infection. Number one, contact with others who already have the virus. And two, contact with the asymptomatic carriers which may have the virus and don't know it. And three, it can just show up out of thin air. The wind blows it into town. It just shows up out of the blue. There's not much we can do about this case. It's just a remote, random situation we just have to accept as part of life. Consider this scenario. There's a dark room in your house that may or may not have mosquitoes in it. And you go into this room, and assuming that you cannot hear the buzz of the mosquitoes when they come around your ear, you stay in the room for an hour. And you come out of the room. If you come out of the room with no mosquito bites, you can be assured that really there was no mosquitoes in the room. If you come out of the room with, say, 5 mosquito bites, you can say, well, there was a few mosquitoes in there. But if you come out of the room with 50 mosquito bites, then you can say that there are a lot of mosquitoes in that room. Let's treat the asymptomatic carriers as if they were the mosquitoes in this example. If we come out of the room with no mosquito bites, we can assume that the society has no asymptomatic carriers. If we come out of the room with a few mosquito bites, we can assume there are some asymptomatic carriers. And if we come out of the room with many mosquito bites, we can assume that there are many people in our society that are asymptomatic carriers. Okay, let's take a look at some data. The health authorities tell us that the contagion period for the coronavirus is 10 to 14 days. So actually that's a key factor in assessing our risk of our exposure. We're only concerned about those people that have had the virus in the past 14 days. So here's the same spreadsheet I had in my previous couple videos, and the links for those videos are in the description below. You may want to watch those first to understand better what these numbers represent. What's shown on the spreadsheet now is the number of virus cases in the 3 different counties as of 5/16/20, and then the next group shows the number of cases as of 5/24/20, which is today's date. The third grouping on the spreadsheet shows the difference, what was the change over this 8-day period. So you can see in Elk and Jefferson County there's been no new cases in that 8-day span. So we can see that no one has contracted the virus from any of these known cases already. and no one has contracted the virus from any asymptomatic population either. And no one has brought the virus in to our counties from the outside world. I don't have a written record of the number of cases in Elk and Jefferson counties before 5/16. All I can say is from my memory that these numbers have been consistent for the past several weeks. With that in mind, we can say that these two counties have not had any new cases for the last 2 weeks of the contagion period. With no new cases, there can't be any asymptomatic carriers in these two counties. Therefore, wearing masks and the plexiglass shields in our stores at the cashier's counters are protecting us from something that does not exist. It's like spraying ourselves with off insect repellent when there are no mosquitoes in the area. However, Philadelphia County is different. There are still new cases showing up there. Is there an asymptomatic carrier population in Philadelphia County? What we need to know is the number of new cases over the last 14 days, and then out of those new cases, how many can be traced to other older cases. That's what I show in this little example of new cases 1,000 and say 900 cases can be traceable. That'll show us 100 cases that are from asymptomatic carriers. This is a call to action. Send this video to your state and county health officials, asking them to daily publish the rolling total of new cases in the past 14 days and also the number of cases traceable to other older cases. This will allow all of us to accurately assess the risk factor of exposure to the coronavirus, regardless of what county we live in. The goal here is to reduce the fear factor so we can all get back to our normal lives. Also, share this with all your friends and spread the word. If you enjoyed this video, click on the like button below and also subscribe to my channel. Thanks for watching.